Niyati Bhalani, a pediatric dentist, as you might know as a pediodontist. I'm from Mumbai and I've been practicing exclusively pediatric dentistry since last 1.5 years. Here, I would like to thank Baby Chakra for giving me this platform, giving me this opportunity of having a session on their application. Now, today I will be talking about the most common complaints and the most common doubts that the parents as of the young kids have. That is like what are the cavities and what leads to the broken teeth in their child's mouth. So let's address this now. So first and foremost, we need to understand that when, why, and how does the child's milk teeth have cavities? Like how does it take place? So you have to take care of your child's oral cavity, not just when they have the teeth in them, but even before that, before even the first tooth erupts into the child's mouth. Like the primary thing that a parent could do is cleaning the child's oral cavity even before the first tooth is erupted. That is just by using your wet cotton cloth over the finger, wrapping around it, and moving with the oral cavity of the child, cleaning the mouth. After every breastfeed or every bottle milk feeding, anything that takes place, because make sure to clean the mouth and even at midnight when the child is asleep, like in between the night also the child tends to feed, so it's necessary to clean the oral cavity, because we feel that okay, the child is going to get irritated, he or she is going to wake up, then we don't want to clean them out. But no, that is a, we can say, a sole villain for creating any kind of damage to their new coming teeth. So it's better to clean the oral cavity with a soft cloth, cotton cloth, and laying your baby to bed. And take your child, like first visit for a child to a pediatric dentist. It is going to be when within the 6 months of span when the first tooth erupts. So by the age of 6 months or so, it is better to take your child to a pediatric dentist, because it's not necessary that the child is going to have the cavities from the beginning. No, but it is necessary to get it checked by a professional, by a specialist, to know more about it and to prevent from it to happening. So it's as I said, the main culprit here is the midnight snacking, midnight feeding, which takes place. Why? Why is it so? Because I'll tell you which are the most commonly affecting teeth. That is for a child, when we see that there are the teeth, the front teeth, they are decayed, they have got round spots, they've got pits, and they've got rough surfaces. By that case, where the child, it is because when they've got in between night feeding, where at night when a child eats or drinks, not just the child, even an adult, when he or she eats or drinks, at night it tends to accumulate in the mouth, okay, if not cleaned properly, and that sticks to your teeth, your child's teeth, and once it gets stuck, it is going to turn into plaque and ultimately lead to tartar, which we can see in the teeth. So at night the quantity of saliva is also less, as well as the consistency is slightly thicker, which it is as compared to as it is from during the daytime. So the at night the microorganisms do have a party in your child's mouth if it is not cleaned, and it sticks to the tooth. So it is going to harbor more and more microorganisms, and that will lead to roughening of the tooth surface, which is very like a smooth tooth surface. If not clean, it is going to harbor more insects and more microorganisms. In a layman term, as for to scare the kids, we say that there are insects in there, there are cockroaches in there, but there are small cavities which are present, and that happens at night. Midnight feeding and snacking leads to it. So, in order to avoid that, it is better to keep the oral cavity clean. Like I've come across many parents who say that, oh, my child is just 2.5 years of age, and he or she does not binge on chocolates or any carbonated drinks or cakes or chips so much. But even then, we find that he or she has got black teeth, the broken teeth, the decay is there. The parents get such complaints. I tell them it's not the chocolate that is the sole culprit of it, but it is the frequency and duration of the breastfeeding that has been done since the child is born. So it's said that maximum till 1 year of age, the child should be breastfed, and post that, the nocturnal, that is the night feeding, has to be reduced. The frequency has to be reduced. It has to be discontinued later on, in order to avoid any oral lesions or any cavities to take place. And yeah, in children that we say, when the parents say that they've got all the black teeth, what are those teeth called? What is that set of cavities which are present in your child's mouth called? It is called an early childhood caries or nursing bottle caries, which takes place using such feeding habits. And the treatment for such, it is going to include what? Fillings, that is the restorations in our tongue, the root canals, that is what we call as pulpectomies for kids. Then followed by crowns, be it zirconia crowns, that is the tooth colored crown, or a stainless steel crown. And if at all the tooth is so grossly decayed, where it is totally impossible to save the tooth, we need to go with the removal of that tooth, that is the extraction, and followed by space maintainer and everything, which is going to maintain the space for the new tooth to come. Because if not maintained, then the front teeth and the back teeth, they are going to come into that position where they are going to close the space which is present, and that is not going to allow for the new teeth to come in its original position. So those are the different treatment plans which can go about. So, what is an early childhood caries? Like, it is going to take place for the kids by the age of 2 to 3 years of age, as well as till the 7 to 8 years. It depends on the chronology. That is the period of eruption of their first tooth. And that is, you can see that what the first thing that a parent is supposed to keep an eye on for the kids' teeth, the milk teeth. That is the front four teeth. As you can see, these are the first two teeth here, and these two. These are the central incisors and the lateral incisor. The two centrals and two laterals. Okay, those two central incisors, they are going to have a, the parents can see roughening of crevices over here. That is going to be a alarming effect, alarming point where a parent should know, okay, there's something wrong, because that normal patchy white area, it is going to proceed more into a rough surface and into a decayed surface later on. So in order to avoid that, the parents have to keep an eye. And the most commonly affecting teeth in early childhood caries are the front four and the last molars, which are there for the children. Okay, because of their eruption age. And the adding effects will be the any deleterious habits like thumb sucking, lip biting, or digit sucking, which is going to add on to the damaging of the teeth. And the least commonly involved teeth that we can see is the lower front teeth. Why? Why are the lower front teeth least commonly involved? Because they have got tongue resting behind it. So that is going to self cleanse the area. So these are the least commonly involved teeth. Which are the primary factors which are going to lead to the decaying of your child's tooth? That is the dental plaque, which takes place. There are different microorganisms into the oral cavity, like Streptococcus mutans, or the feeding patterns, as I talked about, the frequency of feeding, the duration of feeding. All of that is going to harm the teeth, along with the brushing techniques, like kids take the brush and just run about like this, just run about. No, that is not the right way. There are different methods for different age groups. If they are supposed to be taught that, and they are supposed to do it properly. And frequent intake of sugars, that is sugar, like the child is having a sweet tooth, they want to binge on anything that is sweet, like be it sweets, traditional Indian sweets, or chocolates, or any damn thing. The other factors which might lead to the worsening of the teeth are any immunological diseases or any autoimmune disease that the child already has. Special children also, we find the teeth to be more damaged as compared to the normal ones, because their developmental deformities lead to developmental changes in the teeth as well. The enamel formation also affects. So they are also going to have more, like the autistic kids, the cerebral palsy kids, they all going to have their teeth which are not properly developed, and the enamel is not properly developed, and it is going to lead to a pitted and cavitous teeth. And other factors, the main major factor that we see is like people have that tendency that okay, there's just a small spot in the tooth. The parent is going to see that spot, the child is not. So we cannot blame the child over it that okay, you did not tell that you've got something in your mouth. The poor kid is not going to know what is there inside his mouth. So the parents, when they brush or they clean the oral cavity, they are supposed to look if they have, if they even a small black dot on the child's tooth. It is better to consult a pediatric dentist, because that small black spot, it is going to change into a more deeper and a more bigger spot, which is going to lead to more and more advanced treatments, which can be treated with just one small spot. A small filling could have solved that, but the ignorance part which has led to it, it is going to increase the decaying of the tooth. The most thing is the awareness. Like people used to be in the a few years back, if we see the tendency of people where people are like, okay, there's no pain, so there's no need of going to any dentist. Okay, there's no pain, then why do put the child through so much of trauma, so much of pain, or why to get them to any hospital setup or any dental clinic? But then once they get pain, they go to a normal general practitioners, the dentist. Yes, they're good in treating their patients, but what we suggest is for kids, if you see, like if you have a broken arm or a broken leg, you're going to go for an orthopedic surgeon, right? You're not going to go to a gynecologist, definitely. So it is better to choose a specialist, especially for you and your kid. So choose a pediatric dentist where you can go and be aware about what all is going in your child's mouth and what all can be done. And even if you don't see any kind of cavities or anything in child's mouth, and make a point to visit to a pediatric dentist at least once in 6 months or 1 year and get it checked to keep the child also motivated. Like even in any future, if they feel they might have the, they might have to go to any dentists, they should not be scared. They must be aware of the environment, and they should definitely make a visit and get to know about their healthy teeth as well. So it's better to go before anything happens. Sooner the better, we say, and better late than ever. So basic home remedies that you can do is use a soft bristle toothbrush, or use, and for small kids, use small head toothbrushes, and avoid any kind of sugar binge, and make a habit of cleaning the oral cavity, cleaning the mouth, rinsing the child's mouth after everything he or she eats or drinks, because that will help a lot. Even during the daytime, when the child is eating or drinking, like after any meal, ask them to at least rinse or gargle the mouth. And if they have had anything sticky or anything hard that might stick to the tooth, it's better to ask them to brush their tooth, because it's not necessary that you use toothpaste every time. You can just take the brush, wet it, and move it around in the circular motions and remove whatever is there inside the mouth, so that it does not adhere to the tooth and it does not lead to the formation of cavities. So, like, and when you go to a pediatric dentist with such teeth, then they will give you the proper guidance, like what all has to be done, like in like basic minimum early childhood cases, the child might require fluoridated toothpaste, then dietary counseling and all of that. Then in the severe early childhood case, fluoride varnish, sealant, and everything, it can be used for the child. And as I already said, for the fillings and root canals and extractions, that will depend on the extent of the decay which is there in a child's mouth. And even the parents are made to understand. Like they have the tendency, why to waste so much, like why to spend so much for the milk teeth which are definitely going to fall off. But no, those teeth, if not saved and if not treated properly, they are going to harm the permanent ones. And those permanent set of teeth, once they are gone, they don't have any natural replacement. Then you might have to go for the advanced treatments like implants and everything when it grows. So it's better to save what you already have than to invest into something which is not going to be natural. So it's like stay focused on what is there, stay focused on managing the child's oral cavity, managing their food habits, and as well as emphasis like meet your pediatric dentist uh, often and get to know, learn about it, learn about all the possibilities of the decay. And there is still more to it. That's like going from no teeth into your mouth to 20 teeth to go 32 teeth set of teeth in the entire oral cavity. The growth and everything that takes place has no bounds. There's a lot more to talk about it. We can go on and on, but yeah, this session involves like educating you about the cavities which are there into the mouth, how you can take care of it, and what all preventions can be done. And so, like for anything that you have, any questions or any doubts you might have, you can find me on Baby Chakra by the name of Smiling Prodigy, as well as you can find me on Instagram and Facebook by the name of Smiling Prodigy. Now, let's get to the few live questions that we are getting on our private chat. That's okay. Uh, yeah, so the first question we've got here is, if I get frequently get cavities, will my child also get them? Yeah, transferring from parents, especially from mothers to that of the child. Yeah, what I can say is, yes, there is a tendency where use of like pacifiers, like the mothers might have that, habit of just touching the pacifier or tasting it, or just getting whether it is properly done or not, and then giving it to the child, or tasting before giving it to the child, any spoons or utensils, and then giving it to the child. So that will harbor your microorganisms. They are going to transfer it to the child's mouth. So in order to avoid that, just prevent any cavities to occur in your child's mouth. Take care of your own teeth, as well as care that you avoid such transmissions, that is from your mouth to the child's mouth. So yeah, this is how it goes about. And yeah, we can see what are the risk factors. The other the question that we've got here is, what are the risk factors for cavities in kids? As I said, the cavity depends on the extent of the cavity. A normal decay, a small decay in the cavity in the mouth, as we can see here. You can see here this. This is a decay which is there. A small oral deep. It is going to we're going to clean it, and we're going to do the normal filling. But if it is deep, it is reaching into the here. What we call is, see this. You can see, yeah. These are the root canals of the tooth. Fine. Here also. These are the root canals. If not treated properly, if avoided, then this cavity, it is going to go down deep, and it is going to form abscess or any kind of infection into the tooth, which is going to lead to a swelling into the mouth, or and that might lead to doing any root canal treatment, that is a perfectomy for the child. And if the tooth is grossly is extremely decayed, we need to remove that tooth. And if they've got the support of the posterior behind the other tooth, then we have to put a space maintainer. If not done that, then it is going to, if the treatment is not done, the patient is going to have the swelling, the pain, the discomfort, as well as it is going to harm the tooth bud, which is there for the new teeth. That is the permanent which is going to come into the oral cavity. So it is going to harm that. So in order to avoid that, in order to have your new permanent set of teeth properly, like there might be chances of white patchy teeth which might come up, which we call as hypomineralized tooth, which is, so to avoid that, treat your primary teeth first, that is the milk teeth first. If needed for a root canal, go for a root canal and a cap. If for an extraction, go for an extraction, that is the removal of the tooth followed by a space maintainer to allow your new tooth to come into its original position. So yeah, the risk factors are these, that avoid it might lead to non-eruption of permanent teeth as well. or delayed eruption of the new tooth. So avoid that by having getting your child treated for the primary teeth. The other question that we have here is, my child is 2 years old and he has sweet tooth after every meal. He wants chocolate. Will it harm the teeth? What should I do? Yes, it will harm if not taken care of. It is meant to be like the children are going to be binging on sweets, but not every meal. I would suggest that you have kid, you let your kid have the chocolate or sweets. Immediately the kids are not going to cut down on chocolates. Okay, so go with a normal remedy of, if you're giving three chocolates in a day, go to one, like go to two chocolates for 2 days, then shift to just giving one chocolate in a day, and give the alternatives like artificial sugars, which can be given for small kids, like 1 year, where they are taking pacifiers or something like that. You can give xylitol pacifiers, which are the artificial sugars, which are not going to harm the, and it is advisable to cut down into the chocolates and ask the child, like, give them the idea that if you're having such needs, like, put a particular day in your week where the child can have a chocolate, and after having a chocolate or chips or anything, he or she has to brush their teeth and keep it clean, because having a chocolate, it is not going to harm. It is going to be like, that chocolate sticks to the teeth, it is going to be more harmful. So it's better to clean the teeth after having a chocolate, and keep just one, like once in a week, like Sundays, where the child can have a chocolate, and every Sunday he can have a chocolate. It's fine. We are not saying that don't have chocolates, but what measures are to be taken? It is better to clean the teeth, and the parents themselves will have to cut down. And till the age of 2 to 3 years, I would suggest that go with the artificial sugars, and not expose the children to as much as sweet as possible, and any carbonated drinks or sweets or any acidic drinks or anything which is going to harm the teeth. So, and all this, the parents will get a knowledge about it once you see your pediatric dentist, and talk to them about it. So yeah, this is how we can go about. My so yeah, we can say now, sooner the better. Be aware of what is going on around you, like inside your child's mouth, inside your mouth as well. And as I said, there's a lot to talk about it. Like there's no boundaries, there's no bounds where I can give a full stop. Okay, that here my discussion ends. There's a lot to know. Like the field is very vast. As I said, from no teeth into an infant's mouth, into a child's mouth, where they're just gum pads, till having their first set of milk teeth, that is a 20 teeth, till the adults, there's a permanent teeth, 32 teeth that they have. So there's a huge set of information that can be shared. So in order to have any questions you want to share with me, you want to talk it out to me, you can find me on like why baby chakra, by the name of Smiling Prodigy. You'll find me on Instagram and Facebook as well by the name of Smiling Prodigy by Dr. Niyati Bhalani. So, yeah, that's it. I would like to say thank you for all of your time, and see you for the next session. And I'll be waiting for your questions and queries and anything that you have to talk to me about.